I'm Supraja, Senior Audiologist and Speech Therapist. Today I'm here to answer some few frequently asked questions about BERA test. If you're new here and if you don't know what a BERA test is, I recommend to check out a previous video on our channel. To tell you briefly, BERA is a short form for Brainstem Evoked Response Audiometry. It is a test done to check the status of hearing. It is commonly done in newborn and children, but it can also be used to test the hearing of adults and people with suspected auditory processing disorders. Now, let's dive quickly into some FAQs. Question number 1. Can't I tell that my child is hearing based on observing their responses? Why do I need to test their hearing? Well, this is such a common question, but the truth is, it is actually very tricky to tell whether your child is actually responding to the sound. Because babies respond by smiling, startling, or turning around to different things like movement in their environment, for different visuals they see, and also changes in the light. So, you can't really confirm that a child is responding only to the sound stimuli and not these other things I mentioned. That's where BERA comes in. BERA is a quick and accurate way to tell that your baby's response is a true response to the sound stimulus only. Question number 2. Is it painful? Well, not at all. It is just a small electrodes are placed on your baby's forehead and behind their ears while they are sleeping. It is nothing but a little nap where they are taking, and I'm just checking their hearing on the side. Absolutely no discomfort at all. Question number 3. Does it have any radiation? Well, not at all. BERA test just picks up electrical activity from your brainstem through these electrodes. It involves no radiation. And question number 4. Can't I just wait till my child grows up? He's just a small newborn or a few months old. Why do I need to put him through such tests? Well, here's the thing. If your kid is recommended to undergo a BERA test, it usually means they have not passed their screening, or it means they have some risk factors like neonatal jaundice, delayed birth cry, or asphyxia. So these risk factors usually can cause hearing loss, and it is best to confirm whether it has caused hearing loss or not as early as possible. The Joint Committee on Infant Hearing recommends that we should diagnose the presence or absence of a hearing loss within 3 months from birth. This is recommended so that we can begin treatment if at all there is a hearing loss by the age of 6 months. By doing so, if there is any hearing loss, it will not affect the speech and language development of your child. If you skip doing a test and wait until they grow up, you may miss out on these crucial months where the kids pick up speech and language. Well, I hope this clears up a few common queries you all had about BERA. If you have any more questions, feel free to ask in the comment section. Thank you.